Hi everyone, thank you for joining us today. We will begin our session soon, but just a few quick housekeeping notes before we begin. If you're afraid you might miss something from the webinar, do not fear, as a recording will be distributed via email within 24 hours. If you have any questions, don't wait until the end of the webinar. Ask them right away through the Submit a Question widget on the left-hand side of your screen, and we'll save some time at the end for Q&A. And lastly, we would absolutely love your feedback. So rate this webinar by selecting the survey widget at the right of the screen. Thanks, and we will begin soon. All right, hi everybody, and thank you so much for joining today's webinar. My dog is running around the house right now, so if you hear her, just pretend she's offering feedback or comments of her own. Super excited to be here today to talk about MuleSoft's Accelerator for Healthcare and all the progress we have made to help you solve your most pressing interoperability needs. Before we begin, just a quick note that you should base your purchasing decisions on products and services that are currently available. My name is Pranav Patel, and I am the Healthcare Product Marketing Lead here at MuleSoft, and I am joined today by two amazing colleagues, Yogesh and Raphael. Yogesh works on our solutions team leading the development of our accelerator, and Raphael works on our professional services team helping our customers take full advantage of what our accelerator offers. Let's start by looking at our short but action-packed agenda for today. Here's a quick glance at what will be covered during this webinar. We'll first start with a refresh on what exactly is a MuleSoft Accelerator for Healthcare and what prompted us to develop it. Next, I'll explain the exciting capabilities we've added in response to pressing healthcare needs and legislative requirements. From there, we'll bring it to life with a demo so you can see the accelerator in action. And lastly, but not least, we'll hear from Raphael about how he utilized the assets within our healthcare accelerator at a large hospital network to rapidly speed up the project timelines and unlock valuable patient data. With that said, let's begin. Before I go into what exactly is the Accelerator for Healthcare, I'd like to first touch upon what prompted us to build it. I'm sure a lot of us have heard the word unprecedented more than we would like lately, but COVID-19 truly brought unprecedented challenges for healthcare, an industry already bogged down by inefficiencies and legacy systems. One of the areas of challenge that we heard most commonly from our customers was the impact COVID-19 had on their call centers. As the pandemic shook the lives of millions, hospitals were struggling to manage the volume of calls from patients who had questions regarding COVID-19 testing, their results, or rescheduling their elective surgery. Hearing this, we knew that building a Patient 360 in an endpoint like Salesforce Health Cloud was critical to serving patients and the overall community. However, we knew that we wanted to address many other challenges we've been hearing from our customers. Some of those challenges were around delivering great experiences for patients, being able to move fast without compromising quality, being able to stay resilient and agile even through events such as the pandemic, being able to unlock data easily and fast from their EHRs to their desired endpoints, and more recently, being able to meet compliance with the CMS and ONC interoperability rules while using MuleSoft and Health Cloud. So this is exactly why we decided to build a MuleSoft Accelerator for Healthcare. The overall goal for MuleSoft Accelerators is to help organizations such as yours to implement critical integration use cases faster and easier than ever before. And our Accelerator for Healthcare does just that. The core purpose of our Healthcare Accelerator is to help organizations deliver connected healthcare experiences faster. And we saw this as a great opportunity to partner with our Salesforce colleagues. With MuleSoft Accelerator for Healthcare, you can power Health Cloud with real-time patient data, simplify EHR connectivity for all your digital health needs, and adhere to the new interoperability rules. The most exciting thing about our accelerator is that it's completely included with your MuleSoft subscription. There are no extra fees or costs associated with using the assets provided, and it's available to you today on MuleSoft's AnyPoint Exchange. Well, by now, I'm sure you're all wondering, what could the MuleSoft Accelerator for Healthcare possibly contain, aside from magic, to help me accomplish all these amazing things for my healthcare organization? Well, I'm so glad that you all asked, because that is exactly what we're going to learn next. Our Accelerator for Healthcare consists of four main components to help you deliver your IT projects faster. First are API specifications that adhere to the FHIR R4 standards, as well as the patient access, provider directory, and formulary APIs necessary to meet the CMS and ONC interoperability mandates. We also provide integration templates that help you use the Fire R4 resources and APIs, as well as perform your integrations using HL7 v2. We also provide custom API policy that uses Fire operation outcome message to report any errors in the APIs. So this allows customers to provide error messages in a Fire compliant format. Also, this policy can be used with any other out-of-the-box API policies provided in our Anypoint platform. And lastly, we provide reference architecture with detailed documentation on each component, so that this helps you better understand how we built a lot of our assets, so that you can spend less time developing ground up and more time modifying and utilizing these resources to fit your organization's unique needs. So whether you're a payer, a provider, or even a life sciences organization, the tools and assets that we've provided you can truly help you reimagine what digital transformation looks like for your company. And so I'd like to talk about what the Accelerator for Healthcare empowers you to do today. Let's dive into the three main use cases that our Accelerator addresses. First, we're enabling healthcare organizations to deliver a patient 360 by providing the necessary APIs and integration templates to accomplish this use case. So the solution gives you the ability to perform a unidirectional sync from any EHR into Health Cloud. And we are very intentional in keeping our APIs and templates compliant with industry standards rather than focusing on a single EHR in order to allow you to connect with any EHR system, whether it be Cerner, Epic, Athena, or others. Knowing we want to keep your EHR or source system as a system of record, we use the push-based mechanism to trigger the push to Health Cloud. And knowing that many of our customers using HL7 v2 but rapidly adopting Fire or R4, we wanted to provide examples of doing this integration using both HL7 v2 and Fire R4. The great thing about these templates is that we've embedded as many best practices as we can into the assets themselves. So regardless of whether you're using HL7 v2 or Fire R4, you'll see that we have included best practices such as reconnection strategies, ensuring delivery of reliable messages with Anypoint MQ, transaction integrity using the Salesforce Composite Connector, and MUnit testing so that you can run unit and integrated tests for your Mule applications. I do want to highlight what we enable using HL7 v2 and Fire R4. So for HL7, we provide you with the ability to use your existing HL7 v2 feed to trigger messages such as patient data in the form of ADT, or if you want COVID-19 test results, you can use ORU. And the best part of this is that you can modify what we're providing to meet your needs. So if you're using another endpoint besides Salesforce Health Cloud, you can make the modifications easily with what we're providing. For Fire R4, we provide examples within Anypoint Exchange on how to design your Fire APIs using RAML. So what we've actually done is start forming the API fragments in the form of data types or libraries so that you can compose them for your particular API specifications adhering to that Fire standard. We're also providing you with 4 specific examples of templates for patient demographic, allergy, observation, and condition resources. So you can look at these templates and learn how to implement RAML specs to meet compliance with the Fire standards. What you'll realize is that our assets provide the greatest foundation to address your integration challenges and opportunities. And on top of that, enable you to modify and customize as necessary to fit your own needs. This theme of reusability and modification based off of what the Accelerator provides to you is going to come up again with the next 2 use cases. For the second use case, we've enabled health systems to leverage the power of APIs for COVID-19 public health reporting. Due to COVID-19, many labs, health systems, and other care providers have mandates to share test results with public health entities. This helps government agencies keep an accurate count of those that are infected, ensure proper follow-up and care guidance, and ultimately help provide a framework for vaccine management and distribution when the time comes. Recently, a large California-based healthcare entity chose Salesforce and MuleSoft to securely transmit test results back to its full ecosystem of healthcare partners. One of those partners being the California Reportable Disease Information Exchange, or CalReady for short. With MuleSoft, they were able to securely share patient records and test results from their internal Salesforce instance to rapidly report data directly to CalReady. The California Public Health Department can now quickly leverage these test results to identify hotspots of the virus, install preventative measures, and make data-driven decisions around reopening certain areas or adjusting shelter-in-place restrictions. Given this is a critical use case for many labs and other healthcare entities around the world, we provided APIs and integration templates that enable you to speed up this integration through the Accelerator for Healthcare. The really cool part is that regardless of regional and local differences, you can modify this template to work with whatever endpoint is required to follow a successfully implemented integration pattern for reporting test results to public health agencies. We are also providing an implementation template comprising of custom HL7 schema to ensure that the messages are compliant with HL7 v2.5.1 with additional constraints imposed by CalReady, as well as a pre-configured web service connector with necessary placeholders for seamless connectivity with CalReady. The reference architecture, including the logical view and the sequence diagram, is also included in the solution. As you can see, we've built the accelerator to work along with government entities and legislative requirements, which leads me to my personal favorite use case, meeting the interoperability mandates with the FHIR specifications and APIs provided through the accelerator. I'm sure the CMS and ONC interoperability mandates have been top of mind for a lot of you. In response, we've provided the full library of 145 FHIR R4 API specifications, 26 of them adhering to the US CDI core profile. With these API specifications, providers have the framework for building APIs required under the new rules. These APIs safely expose patient record information to third-party applications, allowing the patient to access their medical records upon request. The full FHIR R4 API specifications provides payers with the same framework for building the new patient access and provider directory APIs as required in the final ruling. Also, both the provider directory and formulary API specifications are built according to the DaVinci PDEX implementation guide and template that the CMS recommends to satisfy the data requirements. So, whether you are a provider who wants to provide APIs for patient information or bulk export requests, or a payer who wants to build a patient access, provider directory, and formulary APIs with FHIR R4 standards, what we have provided you today will allow you to accomplish any of those things. However, I want to encourage you to think beyond the CMS and ONC interoperability mandates. Yes, we wanted to make meeting compliance as easy as possible for you, and so we developed the resources and assets necessary for you to adhere to the new rules. But we also acknowledge that these mandates are only the beginning of what's to come from CMS and ONC in order to force the healthcare industry into the digital age. So as a result, I challenge you to look beyond the legislative requirements and explore what's possible with the required patient access, provider directory, and formulary APIs. With all this data exposed through APIs, your organization can completely reimagine how you connect and engage with your patients and or members. From mobile apps to web portals, you can empower your stakeholders with the data necessary to make the right decisions for their health and stay connected to their data. You can empower your call center agents with the information necessary to quickly resolve concerns and answer questions from patients and or members. We've done a lot of the groundwork for FHIR for payers and providers to develop new products and services and craft new experiences beyond what's mandated by the government. And so you have the opportunity to take what we built for you and truly push your organization into the digital age. Now, I know I've done a lot of talking at this point, and I'm sure you all are ready to hear someone else finally speak. So let's actually take a look at the accelerator and see how it can help you reimagine the future of your healthcare organization. Off to Yogesh with the demo.
Thank you, Pranav, for the introduction. Hello, everyone. My name is Yogesh Dhimate. I am a Senior Solutions Manager at MuleSoft and part of our solutions team. Today we are going to discuss how healthcare integration is simplified with MuleSoft Accelerator for healthcare. To comply with ONC and 21st Century QS Act, healthcare providers and health plans must publish APIs conformant with FHIR to make information easily accessible by patients and members. They must also provide the ability for patients and members to provide consent for their data to be shared with third parties such as health applications. Adhering to government mandates is of course important, but the great thing about making data easily accessible by members is that it also creates a better member experience. Let's take for example the formulary API. The formulary API can be used to determine the cost of drugs for patients. Let's run through a real example. Raji is shopping for a health plan using this mobile app. When shopping for health plans, this app allows Raji to compare the drug coverage of several different health plans to help her quickly assess which plan has the lowest estimated cost for her set of medications. This app also helps Raji determine the plan level estimated cost for each of her medications under the drug coverage of the health plan. All of this is made possible by the formulary API deployed on MuleSoft. This API is being used to provide the cost information of the drugs and how it would change for different levels within a health plan. This FHIR-compliant formulary API, as well as other APIs you can use for interoperability, are provided as part of MuleSoft Accelerator for Healthcare. Accelerator for Healthcare is a collection of key assets or building blocks like API specifications, implementation templates, API policy, and reference architecture that help you implement critical integration use cases for healthcare faster. So where can you find the accelerator for healthcare? The answer is Anypoint Exchange. Anypoint Exchange is the app store of all integration resources. It can host the assets created by your organization and comes with assets provided by MuleSoft. To locate the accelerator, simply search for accelerator or healthcare using the search bar. Here is the MuleSoft Accelerator for Healthcare. Let's click on it. When you open the main page, notice that Accelerator provides support for many use cases. It supports the use cases like Patient 360, meeting interoperability requirements for patient access API final rule, or reporting notifiable conditions to public health agencies like Calvary. As you scroll down further, you can see more details of each use case. And here is the formulary API we saw a few minutes ago. You saw the API in action in an app. Let's see how to put it into action. When you click on the API spec, you will get to the YAML specification of the formulary API. Here you can notice the different endpoints and the methods available in the API. Additional details like supported query parameters, response types, and example payloads are available as well. You can use the mocking service to quickly try out the API and understand how it behaves. Of course, the spec needs to be implemented. To do that, click on the implementation template. This template provides the scaffolding of a Mule application to implement this API. It follows all of MuleSoft's best practices. That means all the hard work is already done for you. Let's open this template in Studio and see how it looks. As the template opens in Studio, you can notice the structure and organization of the project. For example, there are configuration files for different environments that will make it easy to move the application from testing to locally to dev or production. You can easily create new configuration files. for any environment by simply copying and pasting an existing environment configuration file. The code follows other best practices around error handling, logging, or reconnection strategy. In this API implementation, you can see how the formulary information is being fetched from the backend database. And once the template is all configured, you can deploy it in the cloud or on premises, it's up to you. And this is how you would power the drug pricing and plan information you saw in the mobile application with the formulary API spec and the implementation template. With the API specs and implementation templates provided in the Accelerator for Healthcare, payers can not only build an API for exposing drug information in a FHIR-compliant format in weeks, but they can also use this data to build patient-facing experiences like the mobile app much faster than ever before. With this, I'll hand it back to Pranav.
Alright, I'm back. Thank you so much, Yogesh, for giving us a demonstration of the Accelerator. I hope that gave life to the use cases and the potential of the Accelerator that I've been speaking to throughout this webinar. Now, I will turn it over to Rafa, who will actually speak about a customer who utilized the Accelerator and the impact it had on their project timelines. Due to the sensitivity of the project, we did have to anonymize the customer name. However, I hope that the impact we made is as clear as ever. Off to Rafa with the customer story.
Hello everyone, my name is Rafael Olter. I'm a senior solution architect on the MuleSoft professional services team. As part of the services team, I work very closely with our customers in order to ensure that they're able to execute on their projects as well as achieve their many digital transformation goals. Today I'll be briefly talking about the use of the Healthcare Accelerator in one of our customers, a large healthcare provider that was looking to achieve a patient 360 view through the use of Health Cloud as well as MuleSoft. In a nutshell, the use cases were heavily around bidirectional updates as well as data feeds between Salesforce Health Cloud and the EHR system. Some of these bidirectional data points included things like patient demographics, insurance and guarantor data and updates, as well as read-only data for immunization, appointments, and medications. These use cases were critical to empower the contact center agents and staff while using Salesforce Health Cloud really to accelerate and modernize their day-to-day activities workflow. Given the nature of the systems involved, we used both FHIR and HL7 v2 integrations. And by leveraging the MuleSoft HL7 v2 connector, we were able to read and write custom HL7 segments. From an accelerator perspective, we were able to leverage some of the implementation templates provided, as well as some of the API templates and fragments to create multiple reusable APIs to power not only these use cases, but future ones. We estimate that by leveraging these templates and fragments, we saved about 3.5 weeks of a single person's time, or about 140 hours. For instance, we were able to make use and leverage some of the HL7 ADT implementation template, as well as quite a bit of the different FHIR fragments and resources provided by the Accelerator. And that was my quick overview. Thank you, and have a great day.
Thank you, Rafa, for that overview. I always love hearing the impact our accelerators have on our customers' projects and timelines, but also the impact they have on helping healthcare organizations serve their patients and the community. As we wrap up, I'd like to just review what's included in the MuleSoft Accelerator for Healthcare and what it can help you achieve. We provide pre-built APIs, reference architecture, API policy, and integration templates to help you accomplish a patient 360, electronic lab reporting, and meeting the interoperability rules. And all of this is included with a MuleSoft subscription. However, with all these assets and the FHIR resources provided, the possibilities of what you can achieve are endless. I like to think of this as just the beginning, the foundation of what's possible. I encourage you to explore our Exchange page and see for yourself all the assets we provide to help you move faster. the projects, and the initiatives healthcare organizations can achieve with what we provided can truly improve the lives of patients, and it would be an honor to help you in achieving that. As our time together comes to an end, here are some next steps. If you have any burning questions, feel free to reach out to us either through the question widget or through email. I also encourage you to visit the resources section of our website where you'll find ebooks and other webinars. And lastly, as I mentioned just now, you should also check our Exchange page where you'll be able to explore the over 180 connectors and templates that we provide. With that, thank you for all your time today. You all have been a truly amazing audience. Now we'll open it up for Q&A. All right, we'll start off with some Q&A. So first is, in a use case typically in the FHIR format used in the process API layer or at the systems API layer, I assume this will be at process API so that it can be transformed into a target downstream format. The experience layer may also choose to expose API to outside in FHIR format, so please confirm. Yogesh, you want to take this one?
Yes, Pranav, and thanks for this question because you're exactly right. So FHIR is, as the name says, it's meant for interoperability. So when you are interacting with different systems, exchanging the data, which typically happens in the process or experience layer, that's the right place to use FHIR as an API interface.
Cool. Thank you. Next would be, do we have support for FHIR STU3 version?
Yeah, so currently Accelerator for Healthcare supports FHIR R4, which is the latest and normative standard. We currently do not provide support for STU3 or DSTU2, the legacy versions of FHIR, but it's of course possible to build those specifications and templates using RAML, but Accelerator doesn't provide it out of the box.
Thank you. Next is, does FHIR Accelerator, or does our Accelerator provide the 145 API specifications or a FHIR compliant data model?
Accelerator provides 145 API specifications. So these are pre-built API specs. They are implementation agnostic. So you can download RAML specification or OS specification from Exchange. In addition to API specification, we also have FHIR library. So you can use the data types and fragments to combine the components or building blocks together to come up with your own API specs. And there are implementation templates provided for key use cases like provider directory API, patient access API, or patient 360 use case.
Next up is, does our data reside locally or on our servers?
So it will depend on the implementation model that you follow. As you're aware, MuleSoft provides various deployment models. You can run applications on your infrastructure using on-premise or runtime fabric deployment model. You can also use Cloud Hub, which is our platform as a service deployment model. So depending on which deployment model you use, if it's Cloud Hub, the data will flow through our servers or runtime, whereas if you run it locally in your infrastructure, it will flow through your infrastructure. MuleSoft is an integration platform, so we don't host or store the data unless it's very specific, like a object store type use case or trying something for performance or caching reason, but data doesn't typically reside on any of our servers. It flows through our servers depending on where you run the application.
Thank you. Next is, how does this differ or compare to the Salesforce CRM tool? I'm guessing they're referring to Health Cloud. So the difference between Health Cloud itself and maybe our MuleSoft Accelerator for healthcare.
So Salesforce has you might be aware of is a platform. They offer different capabilities. So Sales Cloud, Service Cloud, Core Salesforce platform, or Force.com are different offerings within Salesforce. Health Cloud is one of such offerings. So it is different than CRM. Health Cloud is very specific offering for the HLS industry. It will help you visualize your patient information in Health Cloud. Think of use cases like Patient 360. You want to look at complete picture of patient, define patient's journeys, provider relationship management. Those cases are typically implemented in Health Cloud, not in CRM. So CRM is your customer relationship management platform. That's how Health Cloud is different.
Awesome. I think this question was brought up a couple times, so I'm going to try to combine it into one. And so the question is, does our design assume a tight binding to Salesforce Health Cloud? And what if a customer's data resides on Google Cloud, Azure, or AWS? How do we work with that?
Yeah, so MuleSoft is an integration platform. It will provide you capability to integrate between anything and anything, right? So it's any point platform. So no matter where your data resides, whether it is on GCP, Azure, AWS, or your on-premise systems, you can take advantage of 100+ MuleSoft connectors to connect to that data and bring it into Salesforce Health Cloud using Accelerator for Healthcare.
Cool. Thank you. Let's see. Here's a question. Since FHIR specifications allow for selective support, what happens when the system you're interacting with does not support all of FHIR v4?
Sorry, could you please read that question again? I did not get it.
Question is, since FHIR specification allows for selective support, what happens when the system you are interacting, I'm guessing integrating with, does not support all of FHIR?
Right. Yeah. So that's a very common scenario. FHIR is an evolving format. There will be a lot of backend systems of record that do not support FHIR out of the box, and that's the gap MuleSoft fills in by taking advantage of the transformation capabilities that our DataWeave offers, the out-of-box library and API specs that we have provided as part of Accelerator for Healthcare. You can perform any type of translation between a legacy platform, whether it is FHIR compliant or not, into 100% FHIR compliant format. So you can integrate with any system, no matter whether it talks FHIR or not, using Accelerator for Healthcare.
Next is, do we have an HL7 v2 to FHIR conversion template?
So we do not have HL7 v2 to FHIR conversion template currently. What we provide is HL7 connector that lets you parse and write HL7 v2 messages. But our team is currently working on HL7 v2 to FHIR converter that will support most commonly used HL7 v2 messages like admission, discharge, and transfer, ORM, ORU, or SIU messages. That is coming very soon.
Next up is, where can we learn more about the API policy?
So the best way to learn about API policies is MuleSoft documentation. It's very comprehensive. We provide a lot of out-of-box policies, whether it is for security, quality of service, message traceability, or logging. You can build your own API policies, custom policies. We have provided some of those in Anypoint Exchange, but the best place to learn about MuleSoft's API policies is going to MuleSoft documentation.
Thank you. Next is, how is HL7 v2 message validated at source?
So MuleSoft's HL7 connector provides capabilities like validation of HL7 V2 messages. In addition to that, you can take advantage of some of the tools that HL7 organization offers, whether it is HL7 validator jar or taking advantage of HL7 validation APIs. HL7, if you look at it, HL7 is very flexible. You will find a lot of custom segments being exchanged. Instead of a standard, I typically call it as a framework to exchange messages. So we are not doing very strict validation of HL7 messages. Otherwise, you end up seeing a lot of false alarms. But there are ways to validate the messages if you're really looking to validate those.
Cool. Thank you. Let's see. There's a question around data privacy. So how is data privacy handled, especially if a company wants to protect two HL7 standards with third-party systems?
So yeah, I mean, this is actually very loaded question. There are various ways to look at data privacy and security. There are a lot of out-of-box capabilities that MuleSoft Anypoint platform offers. API policy is something that we just discussed. Additional things that you can do for data privacy is, of course, using secure socket layer at transport layer, taking advantage of encryption and decryption features that Anypoint platform offers. You can lock down the platform by using automated policy feature in Anypoint platform. So there are different ways to skin the cat, and I can take this question offline and connect with this person separately to dig a little bit deeper into this.
Mm-hmm. Yeah, also to note that there's some really good questions that we most likely take offline and reach out individually just to give you a little more context and information. Another question is, do we include the claims API specifications?
Yes, so we have provided claims API specification, so it contains both claims as well as claims response, and in addition to that, explanation of benefit API specification that you typically use to exchange this information with the members of help.
Awesome. Another question is, can we share a little bit about upcoming features in the next release?
Yeah, so as I mentioned previously, our team is currently working on HL7 V2 to FHIR converter. That is one of the most asked feature for Accelerator. Other than that, we are evaluating different use cases, and those will be announced as we make a decision on those.
Awesome. I think the rest of the questions we would most likely take offline just to provide greater context and attention to each one. But with that, I just want to thank you all so much for joining us today and spending a little bit of your time listening about MuleSoft Accelerator for Healthcare. Like I said, we will follow up with questions that were unanswered individually. And I hope you all have a great day. Thank you.